Good evening, everyone. Myself, Dr. Noman Attar, Spine Fellow from Hiranandani Hospital. Today, I am going to present a very rare case of primary spinal extradural hydatid cyst causing spinal cord compression over a previously operated of same site intraspinal extradural tuberculous granuloma. So, start with the introduction. As we know, the tuberculosis infection is highly prevalent in India, while the hydatid cyst disease is a relatively uncommon. The frequent site for hydatid disease is a liver and lung around 80 to 90%. The bone involvement is a very rare, out of which vertebral column is 50% of this bone involvement. The most commonly vertebra involved is a thoracic spine over the around the 52%. The causative agent for this hydatid disease is Echinococcus granulosus. The purpose of study to report a very rare case of spinal extradural hydatid cyst over the previously operated site of tuberculous granuloma. Our aim to create the awareness among the surgeons about this rare clinical entity and to include in the differential diagnosis of the atypical spinal presentation. So our patient, a 60-year-old gentleman, came OPD in 2017 with the chief complaints of the swelling over left chest wall with the backache and the weakness in the both lower limb with difficulty with walking, and there is a sudden neurological loss with the bowel bladder involvement. There is a loss of power around 3 by 5. There is a tenderness at the D6, D8 level, loss of sensory functions below the D4 level. There was associated symptoms of weight loss, fever, loss of appetite, night sweat during the last 1 month. And on blood investigation, there is an increased ESR and CRP level. We did an X-ray. We found there is a caries rib on the 7th 8. We confirm on the MRI dorsal spine. On sagittal view, we can see that is an intraspinal extradural mass at the level of D6, D8 level. We operated this patient with the excision of this mass along with the abscess and confirmed our diagnosis on the histopathology, where we found the caseous necrosis along with the Langerhans giant cell. So we put the patient on the ATT drugs with the regular follow-up, and after around 1 year we found complete neurological recovery with the motor and sensory function. There is unfortunate, and this unfortunately patient after 1.5 years again came to our OPD with the similar complaint, backache, complete paraplegia with the bowel bladder involvement, power 0 by 5 with the loss of sensory functions of pain and fine touch. There is a physical examination, plain x-ray were normal. We did the MRI. We found there is an intraspinal extradural multiple cystic lesion over the same area at the D6, D8 level. Other tests like the USG abdomen, contrast MRI, serology were negative. This patient taken for surgery, surgical decompression. We found there is a multiple clearly white cyst in the extradural space. We washed the wound with hydrogen peroxide and with the normal saline. We confirmed the diagnosis on histopathology. We put the patient on albendazole for 3 months, and patient recovered around in 2 months, and fortunately there is a no recurrence in last 2 years of regular follow. On discussion, as we know, tuberculosis hydatid disease is a public health problem. The India has highest burden of tuberculosis, but the hydatid disease is more common in Andhra Pradesh, Tamil Nadu, Gujarat and West Bengal. And we know the route of infestation is either fecal-oral route or the direct ingestion of the parasitic eggs. As we know, the spinal hydatid disease is a very rare, around 0.2 to 1%, but there is appearance of tuberculosis followed by hydatid disease.
I think we've run out of time.